Is critical care pharmacy worth it? In this video, I'll be sharing with you our research on the salary, satisfaction, job demand, and flexibility of this career path for pharmacists. So buckle up, grab a snack, and let's have some fun together. Let's dive into the perks and pitfalls of this potentially stressful, if not fun, career for pharmacy. If you're new here, welcome. I'm Dr. Alex Barker. I'm a pharmacist who became a career coach. What? And I do this stuff all the time in this series about careers and pharmacy and whether or not you should consider these career paths. So if you haven't already, hit that subscribe button like your patient's life's depend on it, and you just gotta hit it. You gotta hit it. You gotta tap it. And I don't know why else. You just gotta tap it. Let's begin our exploration. You can think of critical care as synonymous with the ICU, the intensive care unit, where the most illest patients of all. What's that? Ill? You know, the kids say now that if you're ill, like it's sick or it's cool. The ICU is where the most illest patients of all go to get healed. And you as a pharmacist play a role in the medication and transference from sickness to health in that setting. It's dealing with acute problems for a very, very critical nature. Hence the name critical care. We're talking organ failure. We're talking brain trauma. We're talking drug-resistant infections, baby. Oh, doesn't that sound like so much fun? My one critical care rotation was so gross. I remember just the worst infections ever. And just, for me, it wasn't my bag. But for some people, they love that kind of stuff, and more power to you, because I don't want to do it. You're dealing with pharmacotherapy, pharmacokinetics, and of course, the ever important medication safety in these settings. You're monitoring drug levels, patient response, all sorts of things. And typically, patients kind of out of commission. They aren't usually responding. They aren't awake all the time. And so you get to look at levels and other, hard data. While we don't have exact numbers of people practicing in this field, we know that from the Board of Pharmacy Specialties that there are approximately over 4,000 board certified pharmacists with this certification. I'd probably add maybe another 1,000 or 2,000 that are practicing in these fields but don't have the certification. I could be wrong about that. It's a guess, but you don't ever guess in critical care. Don't. You can guess if you're making a YouTube video about career paths. Typically, pharmacists that are getting into this field have to go through a PGY1 and often a PGY2 within critical care. You can get relevant experience over time to transition into a role like this, but the PGY2 is perhaps the quickest way of getting into this field. Typical job titles are critical care pharmacist, critical care clinical pharmacy specialist, and ICU pharmacist. Now, before I dive in and share our data, I'd like you to guess, what do you think the average is? Heck, median, I don't care. Just guess, put a number below and let us know what you think they get paid. The average pharmacist gets paid around $126. So take that with a grain of salt, put that number in there and pause. And now to reveal, what do they make? What's their salary? Well, according to salary.com, the average ranges between $120 and $130. What? You do all the specialized training and you just get paid the same amount as every other kind of pharmacist? What? Yeah, this is the problem with clinical pharmacy in general. They don't seem to be valuing very much the amount of training that goes into being a specialist and being responsible at that level for that level of practice. I mean, it just doesn't seem to pay out very well. ZipRecruiter has a little bit of a higher range, noting it to be 134. California has the highest range of all, but that should be expected as California has one of the highest costs of living per state. So you should expect to be paid more there. We found a few jobs as an example. This job out of Boston pays $129 to $154, a little bit higher than the average, but then again, this is within a major metropolitan hub. I think that the average is probably a little bit higher than what these salary websites report. I would say that it is contingent upon your ability to negotiate, but in general, for the extra 2 years of education and training, for the specialist nature of the job, for the risks that are against your license for practicing in a field like this, the salary is not that great by comparison. I mean, you can go out and get a retail job and get paid the same exact amount without a residency. For those reasons, I'm going to give this score a 6 out of 10. So how satisfied are these kinds of pharmacists? Well, there's not a ton of data, but what we do know about the critical care setting from multiple other professions is that this obviously is a high stress situation. You're dealing with people's lives. This isn't AM care where you're getting a nice visit from someone. Maybe they're a little overweight. They have some chronic health conditions, a heart condition, diabetes. You can take it easy. You know, they're not going to die in the next minute. But in the ICU, people's lives literally are being supported by healthcare. They could die at any minute. Knowing that, you carry the burden of someone's life in your hands. Yes, of course, it's multidisciplinary. There's other people that are there. And of course, the physician holds the vast majority of that responsibility. But still, you're a part of that team. And with that carries a weight, a heavy, what I would call a spiritual or emotional weight. I don't know if you believe in the spirit, it doesn't matter. It's going to weigh on you. And for every person that I've met that works in these settings, there isn't a story that they can't tell me where something hit them emotionally, deeply, impactfully, where they lost a patient. There is a high level of emotional exhaustion, which is one of the key factors of burnout. This has been well documented in many studies that in these high intense settings, over time, they burn out. One study found 61% of pharmacists in these settings were burned out, suffering from emotional exhaustion. However, people within the field tell a little bit of a different story. While yes, it's still a high stress situation, Redditors talk about the ability to see a problem and immediately fix it, and that being incredibly gratifying. One pharmacist said, "Critical care is cool because you get basically instant gratification seeing resolved issues a patient has." While another pharmacist said, "I hate ICU rounds." And another one said, "No refusal, no complaint with patients." And I kind of get that. I think that one reason why some people go into hospital or clinical practice within those settings is that there's not like a long-term commitment to people. You don't have to see something through. You don't have to see them improve over time. They have an immediate problem, broken leg, an infection, whatever, and you get to fix that immediate problem. And there's something nice about that. I think it's really weird to say this, like no complaints with patients, because in the ICU, they're typically not awake. They're not present to things. And that's kind of like saying, yeah, I like my kids when they're asleep and not talking. It's my perspective. I'm flavoring it a little bit, but there's definitely a kind of person who would really enjoy that work where you don't have to deal sometimes with a little bit of the, I don't know, realness of dealing with a patient and their problems. It's almost more mechanical, right? Because cars can't talk, but car owners do, and they can be problematic at times. If you just look through Glassdoor's company reviews of employees that work at major institutions that have ICU pharmacists, you'll find that a few of them are higher rated than the norm. 3.9 at UC Davis, Loma Linda at 3.6. You know, I think in general, if you're working with the ICU, you're going to have the same problems as everyone else. It's going to be work-life balance. It's going to be on call. It's going to be bad shifts. It's going to be understaffed places. It's the same problems. And because of all of these reasons, the satisfaction score I find for these pharmacists is somewhere in the middle. It isn't an extremely fulfilling career path for many people. Most pharmacists want to get into the practice. Most people get into pharmacy because they want to help people with their knowledge. And you get to do that in the ICU setting, but you're somewhat separated from the patient. You don't get to see the whole story. You don't get to see someone go from being very sick to healthy again that you could get in other settings like in AM care, primary care, or even in the community setting. So for these reasons, I'm actually going to give the satisfaction score a 5. So how in demand are these critical care pharmacy roles? Well, if you go to a website like Indeed, you'll see that there's not a ton of them, but these are hard to fill jobs. At the time of this video on Indeed, there was about 740 jobs. and 62% of these were entry level. This is one of the lower numbers we've seen. Typically, what we've observed in pharmacy job markets is that 80 to 90% of the jobs open and available are entry-level positions. This could be because they're seeing that PGY2s are seen as like, that's not an entry-level thing to have. On the flip side, I think that the majority of these employers are major institutions. They hire a lot of people. They could be looking for senior level clinical staff. Meanwhile, on ZipRecruiter, the number was a little bit less, being around 460 jobs available. One study found that a ICU pharmacist was able to decrease the number of adverse drug events by 70%. That's crazy, insane. And they found that in this study that the return on investment was 25 times the cost of having that pharmacist there. These positions, like other clinical pharmacy roles, are hard to fulfill. There's not a lot of training programs. There's not a lot of people out there with this kind of specialty. And so we find sign-on bonuses like this job here that had a $10,000 one. At the time of this video, there's 109 critical care pharmacy residency training programs for PGY2s. That's a ton, but not a lot by comparison to the other PGY2s and PGY1s. Given that there's about 4 to 7 times the amount of jobs open and available to programs, I'm going to give the demand score here a 8 out of 10. Let's learn about the flexibility of being a critical care pharmacist. One of the things that comes to mind immediately is the wonky work schedule. Hospitals don't standardize anything. So while some may enjoy a 9-to-5 job, the vast majority of them will be wonky, weird schedules, from 10 to 12-hour schedules to working weekends to being even on call. Blah, yuck, I hate that stuff. But some may love it. And if you're passionate about this field, that may not bother you at all. These roles tend to not be work from home or remote. And on top of that, many of these jobs demand a dedicated kind of person. These clinical career paths that pharmacists choose typically have the same perks. And it's that the more specialized you go, likely the more opportunities are available to you. You're not going to be just practicing in a health system. Many of these pharmacists we know burn out over time. We're talking 60%, 70% of pharmacists in clinical settings burn out eventually. What we find is that they can transition somewhat easily into things like academia, pharmaceutical companies, consultant roles. So you're not just stuck within the clinician role. After all, in the world of critical care, there's a lot of specialty drugs that you'll be using for very intense situations. And there's a lot of pharma companies providing drugs in that space. We find that critical care pharmacists, when they want that change of pace, maybe they'll go to a new, different critical care role that has different aspects of the role, maybe more flexibility, more autonomy, which is normally present within most clinical practicing positions like this. Not always. We find that the change of pace is often available to them within academia or in the pharmaceutical company space. Given these reasons, I'm going to give the flexibility score a 7 out of 10. As we draw our conversation to a close, what is my final score for this very illustrious and specialized career path? Well, for salary, we said that it's competitive, but it's not any better than any other pharmacy role outside of community or hospital. So I gave it a score of 6 out of 10. For satisfaction, I said it was a 5 out of 10 because of the high risk of burnout in these settings, the high stress. But for those, it can be the right fit and role when using a lot of your hard skills to immediately solve problems for patients. For demand, I gave it a very high 8 out of 10, given that there are a lot of positions available, about 4 to 7 times the amount of PGY2 programs that are open as of this time. And for flexibility, I gave it a 7 out of 10, being that you can somewhat easily transition into other fields outside of the clinician role, and that there are plenty of other jobs available to you should you be considering switching employers. Putting it all together, critical care pharmacy gets a 7 out of 10 on our rating for this career path. Are you considering going down this career path? What other factors are you thinking about? Do you think this has longevity for you? Like, can you imagine yourself being, 50 years old and still being in that high stress environment? for the right person, it's totally the right fit, right? We need people like medics, people who are doctors that will perform invasive surgery on people. I mean, that high stress, some people thrive in it. But for others, and I find for most pharmacists who tend to be more even keel kind of people, more risk averse, they tend to not like those kinds of settings. So I kind of feel like this score is a little bit higher than what I would give for most pharmacists, but it tends to be fulfilling for the right kind of person. Let me know what you think in the comments below. I hope this video was helpful to you, and I really appreciate your feedback as we continue this series of careers for pharmacists and whether or not they're worth it for you. Until I see you in the next episode, take care.